Welcome, everyone, and thank you for attending our session this morning with Dr. Heide on hearing loss, a public health concern. Dr. Heide probably has one of the most impressive audiologist profiles I've ever seen. I'm looking at this, and she's been treating people here, working in the Madison area, in hospitals, clinics, and in industry for over 30 years. She founded her own clinic, Audible Difference, in 1991. She's worked as a researcher with Nicolay Instrument Corporation, developing a digital hearing aid. Uh, she has publications. She's taught at the UW. It's a full career. And I think we're blessed to have her join us today for this very important topic. Dr. Heide, if you could jump in here, introduce yourself just a little bit more, and then begin, please.
Oh, sure. Well, it is my pleasure to be here today. I just love when people want to know more about audiology because usually when I tell people I'm an audiologist, the first thing they say is, "What?" Sometimes they're teasing me and sometimes they're serious. So, any chance I get to help people understand how important hearing is and how it changes people's lives, it is a pleasure to be a part of that community of interested people. So thank you all for being here today with me. I really appreciate your time, and I'll do my best to honor our time frame today. Um, and I'm just looking forward to sharing the information with you. The concern of public health is interesting. There's a lot of interesting research coming out of Johns Hopkins about hearing loss as a public health concern. And so, in addition to audiologists being concerned about hearing, now all of a sudden we're getting the attention of primary care physicians. They're saying to people, you need to check your hearing. You need to follow up with recommendations to do something to correct hearing loss or manage hearing loss. So we'll find out some more about that today. There. Today we're going to talk about how we hear, who has hearing loss, why does it occur, what are some signs of hearing loss, what about the consequences of untreated hearing loss, who can help, and what about all those new technologies. So we're going to go on a little adventure. Well, Dr. McCoy is conducting Captain Kirk's annual physical exam. And Captain Kirk reports that he's having some problems. His ears are ringing, and he frequently has to ask to have things repeated. He's having trouble understanding speakers with foreign accents, and he feels kind of stressed, straining to hear what others are saying. And he keeps telling other people if Chekhov would just speak more clearly and didn't have that Russian accent, he could understand him better. He also feels embarrassed to meet new life forms because even with his universal translator, he's misunderstanding what others are saying. And his relationships are suffering. He feels annoyed at other people because he can't hear or understand them. Women are mumbling, and he even yelled at Yeoman Rand the other day. Bones is very concerned. He talks about the causes of hearing loss, including hereditary factors, noise exposure, cardiovascular changes, metabolic changes, injuries to the head, viral infections, and ototoxic drugs, or drugs that harm hearing.
Ears are constantly active. They pick up sound waves and change them into information that the brain can interpret, such as music or speech. Sound is a pressure wave that can vibrate either quickly or slowly. Slow vibrations produce deep sounds, while quick vibrations produce high-pitched sounds. Sound enters the ear and is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets the ossicular chain in motion. The ossicular chain consists of the hammer, anvil, and the stirrup. Sound vibrations move along the ossicular chain and into the inner ear. Within the inner ear, the cochlea plays a central role. It is here that the mechanical energy of sound is converted into complex electrical signals, which are then passed on to the brain. In simplified terms, the cochlea is a spiral-shaped tube filled with fluid. Sensory cells, also called hair cells, line the entire length of the cochlea. These hair cells have varying degrees of sensitivity for the detection of different tones or frequencies. This allows the ear to perceive the entire spectrum of sound. The change from mechanical vibration to electrical pulse is a complex process resulting from the movement of hair cells in the cochlea. Along the entire length of the cochlea, the hair cells are arranged like the keys of a piano. Hair cells located at the base or lower region of the cochlea are responsible for high frequency, while hair cells at the apex are responsible for the low frequencies. As the fluid in the cochlea is set in motion, it causes a corresponding movement of the fine structures on the surface of the hair cells to take place. These movements cause tension differences, which produce electrical signals that are passed along the hearing nerve to the brain. The auditory cortex of the brain interprets this information as sound, for example, as music or speech. The entire chain of events, including the various steps that convert sound waves from the environment into information that the brain can interpret, happens so fast that individuals can hear sound both continuously and instantaneously. Within this complex chain of events, there are a number of factors which can cause an individual to experience hearing loss. A loss of hearing can range from a mild to moderate hearing deficiency to a total hearing loss. In general, there are three main types of hearing loss which differ from one another depending on the part of the ear that is affected, be it the outer, middle, or inner ear.
So Bone scans Jim's hearing mechanism and determines that Jim has a high frequency hearing loss. As we look on the top slide, this is a normal cochlea. This is a normal row of inner hair cells and 3 rows of outer hair cells, all with the stereocilia intact. Below you see what might be Jim Kirk's inner ear, where the inner hair cells are bent over and some are missing, and the outer hair cells are also not intact. So you see the difference between the neat presentation and organization on the top slide versus the ear that has damaged hearing. The graph that the audiologist uses is called distortion product otoacoustic emission measurements. In this graph, the lines here, those 2 lines, black lines, show the normal range, and Jim's right ear has responses within the normal range up to about 3,000 to 4,000 hertz. Above that, you notice that the responses are missing. So again, by looking at this distortion product profile, we can actually find out how the ear is hearing without someone raising their hand or pushing a button when they hear a sound. This is a way that we can tell the difference between sensory hearing loss and neural hearing loss. We never had this tool up until more recent years. Bone says that Jim's tinnitus and hearing loss are most likely due to occupational noise exposure, including noise on board the ship, weapons firing, and explosions. So this is a true or false question. Hearing loss affects only old people and is merely a sign of aging. False. The majority, 65% of people with hearing loss, are younger than age 65. And there are more than 6 million people in the United States between the ages of 18 and 44 with hearing loss, and nearly 1.5 million are school-age children. So we understand now that hearing loss is not just a loss of volume. It's a loss of structure in the ear, most likely, and that structure loss results in difficulty hearing soft speech, understanding speech, especially in noise, and a loss of timing cues that provide spatial information that allow us to localize sound, and also an increased awareness of tinnitus or ringing in the ears. Hearing loss also affects brain function. So we know that brain function declines in older adults with hearing loss, that hearing loss is linked to a threefold risk of falling. Hearing loss is linked to Alzheimer's and dementia. It's linked to increased hospitalization, and individuals with untreated hearing loss are twice as likely to experience depression. So Kirk says, well, can I just become a Vulcan? But Bones warns that untreated hearing loss has consequences. Untreated hearing loss has been linked to irritability, anger, fatigue, depression, withdrawing from social situations, loneliness, reduced alertness, which puts people at risk in terms of personal safety, impaired memory and impaired ability to learn new tasks, reduced job performance, which impacts earning power, and diminished psychological and overall health. That's quite a list. So Bones takes an off-duty moment to talk frankly with Jim. Don't mince words, Bones. What should I do? What factors are responsible for healthy hearing? How do I keep my hearing in good shape? And what can I do to treat the hearing loss I have? First of all, protect your assets. These are examples of different types of hearing protection for different purposes. For example, musicians have special earplugs that allow them to hear with high fidelity. If you're using a chainsaw or power tool, you may want to use foam earplugs or earmuffs to limit the loud sound as much as possible. And if you're doing some target shooting or using guns, you may want to use, again, earmuffs or special electronic hearing protection devices. So there's the proper type of hearing protection for the proper application. We also know that headphones can cause hearing loss. 16% of American teenagers have noise-induced hearing loss as a result of headphone use. Headphones also, as you all know, disconnect people from their environment, and they isolate people, and people can't participate in conversations around them, so they're less likely to cope with multiple talkers when they're in a real-world situation. We also know that getting healthy, staying healthy, really impacts hearing, because hearing loss, as we mentioned, is associated with many chronic illnesses, including diabetes, cardiovascular disease, thyroid problems, chronic kidney disease, cancer and cancer therapies, and of course, medications. And then there's the brain. We know that when sound enters our ears, it passes through a network that goes to our brain that influences how we think about the sound how we feel about the sound, and how we move with it. These are called cognitive, sensory, motor, and reward networks. We know that people who speak two languages or more actually understand and hear better in noisy situations. So learning a foreign language helps you hear better in noise. Music is very powerful and has a positive impact on development, language skills, emotion, and social bonding. Playing a musical instrument is very important. On the left, you'll notice that brain response of a young person, and then the brain response of an older person who hasn't had music as a part of his life or her life. And then look at the brain response of an older musician. Look at the synchrony that's preserved. So someone who's played music for at least 2 years has a biological response that will resemble that of a younger brain. Join a choir. Hear better in noise. They did some research at Ryerson University in Toronto and found that people who joined a choir found significant improvements in their ability to understand speech and noise, discriminate pitch, and overall improvement in cognitive measures of attention and responses to sound. We know that when we hear a bird sing, it means that we're safe. It's a sound of reassurance that we've learned over millions of years. Ocean waves cycle at about 12 cycles per minute, and that's the same cycle as breathing when we sleep. So no wonder we love the sound of the ocean rocking us to sleep. It's one I know I enjoy. Sound, the same sound, can evoke entirely different responses. So let's say I told you that there's a drill today and you're going to hear the fire alarms go off, but don't worry, it's just a drill. So when the fire alarm goes off, you do what you're supposed to do for the drill, but go on about your business and there's no emotional response. But if I hadn't told you that it was a drill and you were just doing your work and all of a sudden the fire alarm went off, there would be quite an emotional response to get out of the building and be safe. So one of the reasons that's important is how we react to sound determines how we hear. The source of tinnitus, or ringing in the ears, is actually in a part of our brain that governs our emotional system and our response to danger. And it's our emotional response to tinnitus that determines whether the tinnitus is just something we notice when it's quiet or something that is bothersome and literally driving us crazy. So what can be done? Well, good professional care is the starting point. Technology may be involved, and some work on your part in terms of training.
Jim, got to let go in there. Don't leave him in the hands of 20th century Madison. What's the matter with you?
Kidney dialysis.
Dialysis? My God, what is this, the Dark Ages? Here, do you swallow that? And if you have any problems, just call me.
I know.
What the hell is that? What are you doing?
Tearing of the middle meningeal artery?
What's your degree in? Dentistry?
How do you explain slow impulse, low respiratory rate, and coma?
Fundoscopic examination.
Endoscopic examination is unrevealing in these cases.
A simple evacuation of the expanding epidural hematoma will relieve the pressure.
My God, man. Drilling holes in his head's not the answer. The artery must be repaired. Now put away your butcher knives and let me save this patient before it's too late.
medievalism here. Chemotherapy, endoscopic examinations. Come on, Jacob, wake up. Paula, can you hear me? He's coming around, Jim. Paula, talk to me. Name, rank.
Chekhov. Pavel. Rank. Admiral.
Fully functional.
So everyone asks, is there a pill for that? And actually, there is a lot of work in therapeutics for hearing loss, not only in preventing hearing loss when people are exposed to loud noise, but in regrowing damaged parts of the ear, such as regrowing outer hair cells. So that's a very exciting area to watch. But Jim says, I'm allergic to, I can't take Otic 6. So what's he going to do? Well, Bone suggests looking at 21st century solutions. And the key components are, 1, see an audiologist and understand your hearing abilities and challenges and find the recommended solutions to solve your specific hearing needs. Amplification can compensate for hearing loss and sensory deprivation and delivers auditory information to reduce cognitive demand. So it's good for your brain as well. Auditory training improves neural timing. Communication training helps you communicate more effectively with people. And healthy habits, all are key components of success. Encourage family and friends to see a licensed audiologist if they have hearing problems or concerns. This is extremely important. Audiologists are trained at the doctoral level to diagnose and treat hearing, balance, and tinnitus disorders. Before you put anything in your ears, see an audiologist. They can diagnose whether your hearing is normal, mild, moderate, severe. They can discuss your tinnitus and help you come up with effective treatments. And technology is a big part of what we do to help people. There are many offerings these days, from personal sound amplifiers, hearables, over-the-counter hearing aids, prescription hearing aids, and implantable devices. For example, hearing aids are converging in terms of the technology. This is just one example of the Starkey Livio AI. It connects to an app on the phone, and it'll actually track your physical movement and come up with a brain score that looks at how often you're talking to someone and communicating. It will translate if you're talking to someone in a foreign language, and it will detect if you've fallen. And people often say this is helpful because they remove their life alerts. Sometimes they don't want to wear them, but sometimes they'll keep their hearing aids on. So this is an added sense of helpfulness to families who can connect to this app as well as to the individual. Rechargeable options are helping people with low vision and dexterity. Hearing aids connect to all kinds of devices, and this may include telephone technology. And that could be your cellular telephones versus landlines. Captioned phones are available to transcribe conversations for those who have hearing loss with increased understanding ability for speech. Assistive devices like this little microphone can help people understand in difficult listening environments like a restaurant or dining room. And there are many solutions for the theaters, including captioning devices that fit in the cup holder for, again, those people who cannot understand even though sound is loud enough to hear. There also are things called hearing loops. They connect the ear like Bluetooth does to provide a clear sound to the individual who's listening. So I'd like for you to hear the difference that listening with a hearing aid provides. So you're going to hear speech inside a church. The T is for telecoil, and that connects to the hearing loop. And the M is for microphone, or just someone wearing their hearing aid. Listen and hear the difference in the way that you can hear with the loop.
We are gathered here today to celebrate the baptism of Lars Spirit. Good morning, everybody. We are so glad you were able to make it here today. We are gathered here today to celebrate the baptism of Lars. Good morning, everybody. We are so glad you were able to make it here to.
So the hearing loops can make a tremendous difference, and I know many retirement communities have installed them to try to help people hear in echoey spaces such as their grand halls or their auditoriums or their community rooms, so that they can understand announcements and people who come to give talks, and again, enjoy connecting and being social. We also have surgically implantable devices, and these are just some examples that an audiologist might determine would be appropriate or helpful for any given individual. We know that training is so important. Just as if you get a new knee replacement but no therapy, if you get a hearing aid but without the training to use it, then your success will be limited. So I often recommend a brain training program such as LACE, or Listening and Communication Enhancement, to help people understand better with their new hearing aids. The National Council on Aging studied 2,000 people with hearing loss as well as their significant others, and they found clearly associated emotional, social, psychological, and physical benefits of wearing their hearing aids. So treating hearing loss was shown to improve all of these variables, which is quite an impressive list. We know that hearing loss treatment is shown to reduce discrimination toward the person with hearing loss compensation behaviors like what or huh, or pretending you can't hear, nodding and smiling but not understanding, anger and frustration, depression, feelings of paranoia, anxiety, social phobias, and self-criticism. All are benefits of treating hearing loss. So if you think your hearing has changed, you're probably right. If you think no one has noticed, you're probably wrong. So use your head once a year and get your hearing checked. It all adds up. Knowledge about the problem, professional care, appropriate technology, communication training, support from family and friends, and a positive attitude. Thank you. So I'm happy to answer any questions that anyone may have.
Please go ahead and chime in, everyone. Unmute yourselves and let's begin the discussion.
Could you explain again what LACE means or stands for?
Certainly. It's a mouthful. It stands for Listening and Communication Enhancement. It's a program that was developed in San Francisco by a group that also developed the fast forward method of teaching reading to young children. And they combined their talents with the Star Wars development people, and they came up with this online training program that works on different components, including rapid speech, auditory memory, hearing in noise, all of the things that most of my patients complain about with hearing loss. And it's you do it for 20 minutes once a day for 2 weeks, and then you're done. And it's amazing the difference in performance that people experience from just learning to listen again.
Thank you.
You're welcome.
Veronica, I understand that hearing aids are often very expensive and not covered by insurance. Can you comment on that? Are there any moves to get things like this covered? It seems like a real, important, thing to have in your life, but often very expensive.
Yes, expense is one barrier to people moving forward with their hearing aids. But just as an aside, I found it very interesting that in Great Britain, where hearing aids are covered by the government, they're free, that the adoption rate for hearing aids is the same as it is in this country, where we don't have the access. And I thought that was really interesting. So the social stigma of wearing hearing aids and people not wanting to bother is actually a bigger barrier. I'm not discounting the price as a concern, but rather I just wanted to balance that with something that I thought was very interesting. There are bills before Congress, who knows when they will move forward, to make hearing aids available over the counter. There are many companies that are ready and waiting to have people buy their hearing aids online. It's kind of a free-for-all right now because of the lifting of some of the federal requirements and mandates. So it used to be that you were required to see an audiologist, physician, to get a good diagnosis and find out if you've got wax in your ears or a hole in your eardrum prior to the purchase of hearing aids. We actually put that legislation into the federal rules in the early 70s because of the activities of door-to-door salesmen. Now we don't have door-to-door salesmen, we have internet that's right in our homes, right? So we don't have people knocking on our door, they're popping up on our screens. But the problem is you don't have the accurate diagnosis and an accurate treatment plan to know what to buy. So I see people who purchase terribly inappropriate devices. I had a gentleman come in with a Ziploc bag full of inexpensive but inappropriate devices simply because he had no direction. So as people move toward more online purchases, for me, I'm very concerned that they be guided by a professional in making good choices that are appropriate for them. An audiologist should work with the consumer to find an affordable solution. So if someone came to me and told me they had limited means, I would want to work to find a solution to provide affordable hearing care for them. The VA, for example, a lot of people don't realize that there may be benefits through the Veterans Administration. Medical assistance covers hearing aids, so anyone who's very low income is covered for hearing aids. The Lions Club has some hearing aid financial assistance that they've been doing for years, as well as they're known for their vision program, but they also have hearing. So I think, unfortunately, there's a lot of advertising and marketing, bait and switch. People are told they can get a hearing aid very inexpensively, and they go in and they're told, no, it's going to cost tens of thousands of dollars. Well, again, they need to see an audiologist first so they understand what their options are and why the audiologist is recommending a certain type of hearing aid for that individual. I'm sorry, I could probably go on and on about that.
Yeah, I have just a quick follow-up on that. What can a person expect to spend on an appropriate hearing aid system that's, you've purchased based on, good professional analysis and everything?
Yeah, it really depends. I know that's a funny answer, but let's say we're just talking about a range of prices. A very basic pair of hearing aids, you might spend $850 per hearing aid for a nice basic hearing aid, and that would be appropriate for someone who has very limited um, lifestyle requirements. So maybe they're at home, they visit with a family, they don't go out to eat very often, they watch TV. So their socialization is important, but it's not they're going out to eat every day, they're having business with clients, they're walking their dog and talking and listening to podcasts and all of that stuff. So the technology can start with a very basic solution, and then it can go all the way up to something that's very dynamic and integrated into iPhones and iPads and TVs and all of that. Those hearing aids may cost um, around, oh gosh, say $3,300 a piece for that high level technology. But that doesn't mean that that's what's presented to everyone as the only solution. So the individual really needs to say, this is my budget. I really need to find something that will work for me, and this is the money I have allocated to spend. And including nothing. People can just be very honest about that.
Thank you.
Thanks for your question, Jim.
Well, Veronica, I was wondering about a hole in the eardrum. I have a friend who somehow got a hole in his eardrum. And then all of a sudden, they're talking about all sorts of implants and surgeries. And I mean, I know you have, of course, haven't observed my friend yet, examined him. But yeah, how does a hole in the eardrum connect to hearing? I mean, obviously, it sounds like a pretty bad deal, but how does that make you ineligible, perhaps, for hearing aids?
Well, I think what they're saying is that the hole in the eardrum has the ability to be repaired surgically,
Hmm.
and that if that's repaired, then the hearing may be restored.
Hmm.
So there would be no need for amplification.
Ah, okay.
But I can tell you the most common cause of a hole in the eardrum, and that's a Q-tip. Those are very dangerous weapons.
Yeah.
So people should not use them to clean their ears at all.
Yeah, at all. And yet, how should one clean your ears without a Q-tip? I mean, even if you get the nice big fuzzy ones, that kind of get stopped before you get there. How do you do that?
Well, the ear actually cleans itself. So the wax and skin migrates from the eardrum out to the outer part of the ear. The wax is actually formed in the outer part of the ear by 3 to 4,000 glands that secrete that oily substance to trap invading particles of dust and dirt. So guess what that Q-tip does? It takes the wax that's formed naturally out here and it pushes the wax down into the ear where it compacts like a butter churn.
Hmm.
And then it becomes a real problem. So use a washcloth, or if you have to use a Q-tip, just gently wipe around the entrance to the ear because that's where the wax is going to fall out naturally.
Hmm.
But resist the urge to plunge into the ear because that's a dangerous thing to do. And the texture of a Q-tip is like that of a Brillo pad to the ear canal. It abrades the ear canal.
Uh-huh.
Great question.
Yeah, interesting. So how do you get earwax? Well, I guess through using that darn Q-tip, right? But how is that how most people would get wax stuck in their ears?
That, and as we get older, um, like all of our other secretions, things kind of slow down and dry out. So the wax loses some of its viscosity and
Hmm.
it becomes more likely to become impacted.
Mhm.
There are some good, what are called cerumen-lytics, and the most traditional one is Debrox, Debrox. That's over the counter. You have to use that twice a day for 4 days, followed by an irrigation. But there's a new product that is my favorite right now. It's more expensive, um, but it works great. It's called Earwax MD, and you just put it in once for 15 minutes, and it dissolves both earwax and the skin that gets wrapped in the wax.
Mhm.
And then again, you rinse it out gently. The process, of course, should never be done on someone with any history of ear disease or known ear surgery, anyone who's been told don't get water in your ears, or anyone with chronic balance problems, because if you use water that's too cold or too hot, it can make you dizzy. So
Mhm.
again, precautionary, but on healthy ears, a gentle lavage or irrigation following use of these cerumen-lytics is appropriate.
I have a question. How can you help someone who is having trouble, like in a restaurant or in a conversation with some noise around you? What are some options for that person to hear better, and for the people with them to help them?
Oh, that's a great question. Um, I mean, the first would be to back up a little bit and to say, if we can, when you get to the restaurant, go early, like 4:35 or later. So avoid the rush where there's a lot of people. We're still kind of in Dane County. We're spaced out enough that the seating isn't as tight as it was pre-pandemic. But if you can, ask for a quiet corner table or a quiet area. But if, let's assume you're in the restaurant and you're having trouble, um, I would get close to the person. You want to be able to shake that person's hand. So if you're talking from the other end of the table, get up, go over and sit next to the person, literally pull up a chair and say, I really want to visit with you for a minute. Let's just talk about whatever. Because that way you're close and the person can see your face. There are masks that have clear panels. I use them in my practice all the time. So my patients can see my face and can read my lips. So if you have a family member that has trouble with masks and they're required, see if you can find, this is by Safe and Clear, and they're an FDA registered level 1 mask they're really helpful for communication. Speak slowly. Give them the topic of conversation. Hi, this is Jane. I want to talk about our trip to Florida. So now they've got all that vocabulary before you just launch into the conversation. And more importantly, speak slowly. That really helps so many people. Just slowing down. Great question, Jane. Thank you for asking.
Actually, that's good advice, Veronica. The practice listening is one thing, but also practice talking. I know a couple of friends who never mention the antecedent, right? The topic of the conversation is just assumed that I know it. And I can see it could be even more difficult for people who are hard of hearing, to have figured out what the speaker is talking about if it's not specifically mentioned.
Yeah, that's the nicest thing you can do. If somebody joins a group, like at a cocktail party and somebody walks into a group, is just say, oh, Jane, they're talking about John's trip to New Orleans or whatever the topic is. And then they're connected. And you can do that for a lot of older adults in retirement communities. Make sure they know the topic. This is what we're talking about today. Here's why we're talking about this topic today. A lot of redundancy is really helpful.
I have one other question. When we were sent a list of handouts, there was like a handout for people to use when they're driving if they're stopped by the police. Could you explain more about that? Is that something that's becoming more common?
Well, I've had that as a request, and there's a lot of fear about, especially driving at night, and being hard of hearing, and then being stopped by the police and not having someone with them to support that they are hard of hearing. And so you picture it's dark, maybe it's rainy, the policeman walks up, and the first thing they do is they shine a light right in your eyes. And you can't understand, you can't see their face, you're frightened and alone. So this is just a way to help explain, well, why is my balance slightly off? Well, I have vestibular disorder. I can't maintain my balance very well. I don't hear very well. You may have to write things down for me, all of those things on that visor.
Mhm.
And it's a really nice thing. I don't know that it was helpful for everyone, but I thought you might find some friends or family that would find it helpful and could pass that along.
Yeah, I think sometimes professionals and like even in the hospital, sometimes even though they know that the person is hard of hearing, they still speak to them as if they didn't have a hearing issue.
Yeah.
Especially with the masks, etc. It's almost impossible.
Yes, my patients complain that these days the physicians are typing at their computers and talking to them and not focus their face forward to them. And of course, they lose the visual information and the hearing information, and it can be challenging. There are some apps I didn't reference. One is called Otter, and the other is called Ava, A-V-A. And so if I launch the app on my iPhone, it does voice to text transcription. So it's kind of like when you do a text message and you hit the microphone and you just talk and it types everything out. And that's really helpful for people who are having trouble understanding speech, even though they're hearing. Maybe their hearing aid isn't working and they're at a doctor's visit and they don't understand what the person is saying. This way they can follow along. And it's free. It's called Otter, O-T-T-E-R. You have 30 minutes of free transcription.
I've used Otter before for transcribing online meetings, and it works really well. So I can recommend that, definitely.
Thank you, Mike. It is really good at transcription. I'm amazed, even with technical medical terms.
Mm-hmm. And this new development with cell phones that automatically and instantaneously transcribe speech. I mean, I turn on my phone, I just have to click that little button, and all of a sudden the text that I'm hearing, is being printed out on my screen. So that's quite helpful at times.
Absolutely.
Yeah. I was wondering about how often have you treated Harley Davidson riders for hearing loss? Those guys go roaring by. I live on a main street here, and those guys go roaring by, and I can hear them. They wake me up.
Well, I have a funny story about that,
Yeah.
just as an aside. I was over at a busy clinic, and it's an outreach clinic, and it was a very small room with a very tiny sound booth and room for maybe one chair. A knock on the door comes, and this guy who must have been 6'5", and he had on a leather vest and tattoos all over his arms, is standing in the doorway staring at me. And he said, "I'm here for my hearing." And I was like, ah, is there anybody out there who can help me? This is kind of scary. Well, he needed earplugs for his Harley motorcycle. So I had him sit down and I was going to make the ear mold impression, and tears just started streaming down his face. And I said, "Are you in pain? Are you hurt?" And he said, "No, I'm scared." So he didn't know what was going to happen, and he was just worried, just like anybody.
Mhm.
So he was a big pussycat.
Uh-huh.
So,
Uh-huh.
so a lot of the Harley Davidson guys actually have really good hearing protection. It's
Uh-huh.
everybody else that is around them that doesn't have.
Right, right. I mean, 5 in the morning, there are a couple of guys in the neighborhood that go roaring by, and it's like,
Wow.
well, also, what's the difference between uh, noise canceling? You know, I, I, if you get some of these earbuds, just regular earbuds, they're $200-300, for a really nice pair, and they're noise canceling. What are you buying when you get that kind of thing, and how do they differ from your basic $800 uh, hearing aid that you were talking about?
Yeah, so sometimes the noise canceling earbuds
Mhm.
are basically canceling mechanical noise. So fan noise, noise in the room, any kind of sound that's going on around you that is, quote, unwanted. The problem is, I had a patient the other day who was wearing them all the time because her home was located in a construction area. They were working a lot around her, so she just wore them all the time. Well, she developed really bothersome and difficult to treat tinnitus because she started hearing her own internal sounds and then got worried about it, and it just magnified the whole process. So we had to wean her off of her noise canceling headphones because that was normal hearing to her. She wore them so long that that became her normal auditory landscape. So she had to actually learn to hear normally again. So they're really convenient and really helpful, and I use them too. But it again concerns me when people kind of go overboard and don't understand the consequence of auditory deprivation.
Veronica, um, can you hear me?
Yes, David, hi.
Hi. Could you talk a little bit about how people can take advantage of hearing loops and what they need within their hearing aids and the conversation they might need with their audiologist?
Sure. When people purchase hearing aids, I encourage them to thoughtfully ask about the presence of the telecoil in the device that they purchase so that they can connect to the many hearing loops that are available. For example, if they went to American Players Theater, or they went to a memorial service at a church, or went to Capitol Lakes to their Grand Hall, there's so many hearing loops. The Fireside Theater. What does it do? We had a slide in the presentation that talked about the difference between listening without the loop and listening with it.
Mhm.
It's bringing that sound directly to the ear. So when people don't have the telecoil in their hearing aids and don't know how to access that telecoil or have it programmed to work, they lose the direct connection to the loop, which means their ability to hear and understand, especially in these big halls, is directly affected. So hearing loops are so important, and we work really hard as a Madison community of the Hearing Loss Association of America, and including the audiologists in the city, to encourage people. Now, a lot of the discount stores do not include information about hearing loops, and online people, they don't care. Their goal is to sell a lot of units of whatever they're selling. So if you know of someone who's thinking about purchasing hearing aids, make sure that they ask about the telecoil in the hearing aid and making sure that the hearing aid they purchase has that in the hearing aid. so they can access the hearing loops. They make such a difference.
What is a hearing loop? I'm kind of lost there.
Oh, it's literally a loop of wire that carries the audio signal. So it's like Bluetooth, but it's a mechanical inductive loop. So the little coil that's in the hearing aid is a little spool of wire, and it oscillates and picks up the audio signal that's being broadcast on this loop. So literally, if you go to any place with a loop, you can just walk in, sit down any place you want. You don't have to ask for special equipment to have headphones or anything. You just push a button on your hearing aid and you can hear the sound from the podium right through your hearing aids. It's amazing.
Fantastic.
It is fantastic. And, you know, they're well, expensive to install relative to some of the headphones and FM systems. They're there forever. Hearing loops that are installed in Europe have been there for centuries, and you don't have to change batteries or worry about sanitizing headphones or cleaning equipment. You know, hearing loops just are there. They work.
Mm-hmm.
So in any retirement communities, I really encourage them, if they're remodeling, putting in new carpeting, trying to enhance or attract new residents, you know, make sure that the common area where announcements are presented or activities are done, that those areas are looped.
Terrific, amazing. We've got a couple more minutes. Please join in. Anyone with more questions?
Yeah, Veronica, I have a question about the digital hearing aids. My father has hearing aids, but he says they're uncomfortable and he can't change the battery. I'm wondering if a digital hearing aid would be better for him.
Okay. Most all hearing aids these days are digital hearing aids. Okay, so that has to do with how the sound is processed.
Okay.
But when you tell me that it's not comfortable, that tells me either that his ear has changed shape since it was originally made, and that can happen over the course of a year or two. Our ears keep growing as we get older, fortunately, very slowly. But the earpiece may not fit well anymore. So sometimes just getting a new earpiece made or having the hearing aid itself recased means that it'll fit comfortably. Because it's not comfortable, I'm not going to wear it, right?
Right. What I'm thinking about is the kind that fit around the back of the ear, and there's a very small piece that fits into the ear. And a lot of times it's used through Bluetooth.
Sure. So those are called receiver in the canal. The receiver is the loudspeaker in a hearing aid. Mm-hmm. And so let me just grab one here. Excuse me. So this is just one of the examples. So the loudspeaker part actually goes into the ear canal, and then the processor goes behind the ear. It's a very popular style of hearing aid, but it's not always appropriate for everyone. There are lots of advantages and some disadvantages. So again, talk with your audiologist about the specific needs of your father, was it? I'm
yes.
Sorry. Yes.
Yeah.
So dexterity, vision, how can he handle things? Is he able to handle a smartphone? Because the Bluetooth connectivity is wonderful. Mm-hmm. And some of the basic phones have Bluetooth, but not all the features are accessible. For example, I saw someone the other day, they had, these smartphones for seniors. I forget the name of them. You know what I mean?
Mm-hmm.
Yeah. So it has Bluetooth on it, but one of the features of the hearing aid is it has a Find My Hearing Aid. in the app. So if you have an iPhone or an Android phone, the full featured phone, you can locate a lost hearing aid with the app. Wow, that's amazing. But some of the dumbed down smartphones that they design for seniors don't allow the full features of the technology. So again, trying to balance what can this person handle and what is it that's going to help them hear the best. That's again where your audiologist should be their advocate for saying, well, this is what this person needs because he needs this, 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 and this.
Okay,
Did I answer your question?
I think so. So receiver in the canal is the name of it.
Style. That's the style.
That's the
But let's
style.
say, just as an example, let's say he's someone that has a lot of wax in his ear all the time, clogging up the hearing aid, then that may not be the best style. Maybe an over the ear with a standard ear mold might be better because the wax isn't going to be clogging up the loudspeaker. Also, this wire is fairly fragile, and if there's someone that they can't handle that kind of fragile connection, they're ripping it off their ear all the time, that little wire is about $100 part, which is
Okay.
nothing in warranty. But if you're out of warranty, that's $100 every time that wire gets broken. Whereas the tubing on the ear mold is like $12 to change it.
Mm-hmm.
So look at both in warranty costs and out of warranty costs.
Okay.
So hearing aid selection and fitting, that's like a whole different topic, but I'd be happy to keep that on the docket for another time.
Okay. Thank you.
Anyone else? Well, Veronica, it seems that everyone's asked the questions for right now. Of course, you've got your information here. Please feel free to get in touch with Dr. Heide, everybody, if you've got further questions. Thank you so much, Veronica, for all of this fantastic information. I mean, I learned a lot, and I love the little story incorporating Star Trek. It was a great adventure.
I'm glad you had a good adventure. You all take care. Thank you for coming.
And thank you, everyone. Bye-bye.
Bye-bye.
Bye.